Thank you. Hi, everyone. Thank you for coming out here. Thank you for introducing us, Grace. And thank you for Portland Public Schools and partnering with us for this Parent University event. I know this is a topic we get a lot of questions about, and we have heard and expressed interest from parents to hear more about. So, without further ado, this is just a little bit of what we will be covering when discussing tobacco and electronic nicotine devices. So there'll be just a short introduction. We'll go into what these devices are, what the trends are nationally as well as in Maine, how these products are being marketed and towards youth in particular, as well as the health and safety concerns that we have. How to take action, how to talk to your youth if you feel like they may be using or if they need to quit. Specifically the Tobacco 21 law that is a new development in Maine. We'll also talk about marijuana and how that pertains to vaping and some recent law changes with that, and then we'll take questions at the end. So Grace pretty much covered this, but we're from the City of Portland's Public Health Division. That works in tobacco prevention. I work in substance use prevention. Do you want to cover a little bit more about what you do in your program?
Well, hello again. My name is Krista Walker. I am the Tobacco Prevention Program Coordinator. So I oversee our tobacco prevention program as well as our lead poisoning prevention program. With our grant fund that we have right now to cover tobacco prevention, we are responsible for covering all of Cumberland County. One of the main things we look to do is to reduce the risk of secondhand exposure. So we go into schools, hospitals, universities, youth-serving entities, and we help them develop more comprehensive tobacco policies. So we have them take a look, do they include vaping products in their policies? Are they talking about a rationale, so why this policy is in place? Are they putting enforcement in there? So that's one of the things we do. We also do trainings with non-clinical behavior organizations on the Maine Tobacco Helpline, which we'll touch a little bit on later. We also have a program called Sidekicks, which we go and train middle and high school students on. It's a youth empowerment training, and it teaches youth how to have tough conversations with their peers. So whether it be about tobacco use and vaping, whether it be about marijuana or drugs and alcohol. So those are a couple different things that our program does.
So I particularly work in the substance use prevention program of the City of Portland, and I do a lot of youth outreach. Krista and I partner a lot because our topics kind of go hand in hand. So I will do youth outreach to different community partners. I specifically work with all the Portland Public Schools, so a little bit of smaller scope, not all of Cumberland County like Krista does. There you go. So we are funded by generally by the CDC, and that money trickles down through Maine Health Center for Tobacco Independence for tobacco funding, and as well as Maine Prevention Services. And I'll elaborate a little bit more on our funding. So the tobacco funding that we receive comes from something called the Tobacco Master Settlement Agreement, and it was in 1998 that all of these states, I believe it was 46, banded together. They were seeing a lot of high medical costs from their populations, and they decided that this was attributed to tobacco. So tobacco companies had kind of deceived people about what the health impacts were, and they had done a lot of marketing towards youth. So these states banded together, had this big lawsuit towards the 4 major tobacco companies at the time. And the end result was that these companies pay certain amounts of money to each state annually, and that funding trickles down, and we're able to do the prevention work that we do. So just a little intro on tobacco products. Maine Health has formally defined this as any product made from or derived from tobacco or that contains nicotine, is intended for human consumption or likely to be consumed. And this includes electronic devices, any components of those electronic devices, which we have some that we'll show you a little bit later. And this is whether or not they contain nicotine. So just some pictures of things you might have seen. On the upper left-hand corner, we have cigars and cigarillos. In the middle, there's a conventional cigarette, combustible cigarette, Critex, which are a tobacco product from India. On the bottom we have chewing tobacco. Bottom middle is snus, which is similar to chewing tobacco, and then hookah. Tobacco is, just some fun tobacco facts, the #1 cause of preventable disease in the United States. Fun fact is also that the majority of smokers, 90% of them, will have started before they graduate high school. Every day, about 1,500 kids are estimated to become new daily smokers, and as a result, about 1/3 of them are predicted to have shorter lives and die prematurely. Tobacco products contain nicotine, and nicotine is a very addictive substance. So, like I mentioned, it's addictive. It's the primary component of most tobacco products. It is also poisonous. It's actually used as a pesticide in some crops. It can be deadly if ingested, so you would not necessarily want to, drink liquid nicotine. It leaves the body. It stays in the body for about 24 hours, so you might have heard of people who are smokers feel irritable or anxious if they don't have a cigarette in a longer period of time, and these are just some withdrawal symptoms that they experience. And then this infographic shows that it takes about 10 seconds for someone smoking a tobacco product to get that nicotine to their brain. So we're going to cover some adolescent tobacco use trends in Maine, as well as what those health implications are, and some community resources that we have to address them. I don't know if everyone can see this, but this is a snapshot from the Maine Integrated Youth Health Survey. It is a survey administered to the majority of Maine public schools. So statewide, this was given out in 2017, and some key facts relating to tobacco are that high school students, had about 9% of them taking the survey had said that they had smoked a cigarette at least once a day in the past 30 days. And then 15% had said that they had used an electronic vapor product at least one day in the past 30 days. So the good news is that the rates of the use of combustible tobacco products, so things like cigarettes, cigars, have declined for high school students. In 1997, about 4 out of 10 high schoolers were smoking and using these products. And in 2017, this was down to 8%, so less than 1 out of 10. And I'll let Krista take it away from here.
All right, so I'm going to give you guys the bad news, unfortunately. Sorry to be the Debbie Downer of the night. But e-cigarettes are the most commonly used tobacco product by youth. We are seeing a huge influx of use of these products all across Maine and all across the country, so it's not just here in the state. We've had multiple different school districts, youth-serving entities, and organizations reach out to us just looking for any information on e-cigarettes and vaping devices that they can get. So a couple different facts. In the US, youth are more likely than adults to use e-cigarettes. And we'll talk a little bit about that later and how these e-cigarette companies are advertising towards the youth. In 2016, more than 2 million US middle and high school students used e-cigarettes in the past 30 days. 4.3% of middle school students and 11.3% of high school students. So that's just a little snapshot. A couple different terms, I'll use a few of them interchangeably tonight. I typically use electronic cigarettes or vaping, but these are some of the terms you'll hear the youth say, or even adults. A big one they're really saying right now is juuling. You'll hear people say juice. I heard some kid talking about a mod at the grocery store the other day, so these words are being used. E-hookahs, box, vaping, tons of different terms, so just kind of keep your eyes and ears open for those. So I'm going to briefly talk about the different kinds of e-cigarette products that are on the market, and then after we talk about these, I'm actually going to pass around some samples and have you guys take a look at those, smell them, feel them, kind of get used to what they look like. So the first one I'm going to talk about is called the first generation cigarette. So these look just like regular conventional cigarettes. They have different components, so they have a rechargeable lithium battery that can be charged with a USB connector, so it can be plugged right into the laptop. They also can be plugged into the wall as well. They have a cartridge that contains nicotine, flavoring, and other chemicals. They are regulated by the FDA, but, and we'll talk about this a little bit later, the FDA is seeking applications from all the companies that make these e-cigarettes, and they want them to include all their ingredients on the packaging, but they're not going to see that till about 2022. So it's a long ways out there. So as of right now, they're not required to have all these ingredients on the packaging, which is unfortunate. Another thing that these products have is an LED light to simulate a burning cigarette, so it kind of feels like you're smoking a real cigarette. So these products, e-cigarette products, were first created in China by a pharmacist who wanted to create a product because he had quit smoking. His father died of lung cancer, and he was looking for a different version of cigarettes that he could use that he thought wouldn't be as harmful. So he came up with this product, and it was first developed to be a quit aid. Just a side note, these are not proven to be a quit aid. There is not a lot of research done on it right now saying that these products are able to help people quit smoking regular cigarettes. So just kind of a background on that, and these are referred to as the first generation e-cigarettes. They're not sold as much anymore, and we'll kind of talk about the other products in a little bit that are more popular, and we have some examples of them. So vape pens is a big one. I've gone into a lot of middle or high schools, and there's a lot of these confiscated. Kids will actually take parts of their own pen, put them on it, so it looks like a regular pen. With a lot of these vaping products, you'll notice they look like regular household products. Weird. They look more high-tech. They operate in much the same way as the first generation e-cigarettes. The only difference with these is they have a refillable chamber that they can put the e-liquid or the e-juice in it, and that's the thing that contains the nicotine and the flavoring. And we'll talk a little bit about the flavoring in a bit, but with these e-juices, they can actually buy like a certain amount of nicotine, so they can buy like a higher amount of nicotine or a lower amount of nicotine. Again, with these products just becoming regulated, it's a little bit harder to tell, like, is it really this much nicotine? So we're gonna kind of see more of that down the lines. So these are referred to as the second generation of products.
Feel free to touch it, feel the weight, smell it. It's a very, very big flavor in that, and it smells very fruity.
Mm-hmm. You can smell it, even from up here, I could smell it over there. It has a very like fruity smell to it. So you can tell why like a lot of the youth are really attracted to these smells.
And they don't smell like a conventional cigarette.
Exactly. So the next one I'm going to talk about is called the third generation products, and these are the mods. So these are a high voltage personal vaporizer. They actually produce larger amounts of vapor, and these are the ones, if you YouTube like vaping or vaping a mod, you'll see a lot of kids that are doing like these little tricks where they'll blow like smoke rings. These are the products they'll use for that for the most part because they get a lot more vapor out of them. They can also hold a little bit more e-liquid or e-juice in it. And these are called the third generation products. These are a little bit more pricey, so we didn't really talk about the prices of the other ones, but you had bought
This one was
that one.
about, I believe, $10 or $15.
So fairly cheap.
And it includes, it's 300 puffs per unit, which is about more than a pack of cigarettes.
Mm-hmm. The mods, so we have a mod up here. When we pass this around, just be very careful. So this was actually confiscated. One of our coworkers has a teenage son, and her son came to her and said, "Mom, I tried vaping. I'm so sorry." So she confiscated it and she brought us and she's like, "Oh, well, they can use it for kind of a show and tell," which is great for us. Sad for him because unfortunately he's in trouble. So be careful with it because the e-juice in it is leaking, so I wouldn't pick it up out of the box. You can smell it right away though, but just be very careful because I don't want anyone to get that all over their hands. And those price-wise are fairly pricey. Those usually go for about $100 to $200. That one actually came from, it was sold by a student, so he bought it off a student. So he had bought it offline, that student, and then sold it to this one for more money. So they kind of have like their own little business going on. So how they work, I won't get too much into the anatomy of this, but basically it's heated, the liquid is heated inside to bring it to a boiling point, which then produces a vapor, which is why it's called vaping. So Juul is one of the big ones now, and I'm sure many people have heard this popular product. You can go to many different vape stores, convenience stores in the area, and you'll see the big Juul sign, Juul sold here. You can get cool mint, mango. So they have all those fruity flavors, again, that are appealing to youth. Oops. Yes, you can pass that around. And that went for about...
Yeah, so this is called a Juul starter kit, and it contains the Juul, the charging device, which looks like this. It's magnetic, and it goes into a laptop. Kind of looks just like a USB. Fits into the palm of the hand. And it comes with the charging device and 4 Juul pods. And this was about $35. I believe that the pods are sold in packages of 4 for about $15. So they're not terribly expensive. And I'll pass this around, and the flavors, you can feel free to open these, feel, and see how they look. They attach in the top of the device, and feel free to smell them again.
And these ones are a little bit different, the Juul. So the other e-cigarette products, you'll actually put the e-juice in there. These ones, you actually have to purchase the correct cartridges for them that you pop in there, so the e-pods. And feel free to sniff those because they smell all sorts of fruity and vanilla. So what's in the Juul pod? These are just a couple things that research has been done on that they found in the Juul pods. So nicotine. Fact is, Juul has one of the highest % of nicotine out of all the other e-cigarette products, which we'll talk about in a bit. Benzoic acid, glycerol, propylene glycerol, natural oils, extracts and flavors, and again, a big question mark, because we really don't know everything that's in these products, unfortunately. So about 20 million devices and pods are produced each month, which is horrifying, and about 70% of the total e-cigarette market is from these products. So these products were actually created by 2 younger men who were smokers as well, and they decided they wanted to kind of glamorize smoking. So they were going out to places and they realized, we can't smoke in restaurants anymore. We can't smoke in public places. And they said, let's find a way that we can kind of make smoking almost cool again, where we have these high-tech products that we can bring everywhere we go. And so they came up with Juul, and here we are today. So Juul, again, is one of the most popular vaping devices on the market right now. It resembles a tiny USB. In fact, it can be charged in a laptop or computer. We have had teachers say they have seen students charging their Juul right in front of them on a laptop. And now that we're starting to educate them a little more, they can actually pick up on it, because if you look at it first, you would just think it's a regular USB device. 1 Juul pod is equal to smoking a pack of cigarettes, so it has the same amount of nicotine that you would find in a pack of cigarettes. So it's a little bit easier with vaping devices just to keep kind of taking puffs rather than with a cigarette. So someone who's sitting there puffing it all day is just about smoking a pack of cigarette, nicotine-wise. They also come in flavors such as mango, cool mint, creme brulee, fruit medley, and cool cucumber. So one other kind of tricky marketing scheme, let me just get all these little things out before I go on. On the package, they put the flavor, but they also put underneath it 5% strength, which is super confusing, because 5% strength of what? They want you to be confused. So how much do they mean? It's actually 59 milligrams of nicotine, and a cigarette itself has between 8 to 20 milligrams of nicotine in it, so that kind of gives you a rough estimate. So in one of those, you would find 58 milligrams of nicotine. So just a couple different things with e-cigarettes in the news. There's been a lot of stuff right now about how the FDA is declaring youth vaping an epidemic right now. One thing they're trying to do is go after some of the big electronic cigarette companies such as Juul. There's another one called Blue, Logic 60. And what they're doing is they're telling them they need to come up with a plan of how they're going to keep these products out of the youth's hands. So they're finding the same things happening like with the tobacco products. They're marketing towards youth. So they're telling them, we want you to come up with a plan of how you're going to keep these out of the youth's hands. We don't really know how they're going to judge the plans when they get them. So that's going to be interesting. So stay tuned for more information. Another one recently, the FDA seized documents from the Juul headquarters. So they kind of just went in and raided a bunch of documents because they wanted to make sure they could get all the accurate marketing information from them. Again, we don't know what the outcome of that is yet. So the vapor. One thing that I like to clarify, if you walk out with anything today, the vapor is not just water, it's not just flavoring, it is full of chemicals. Majority of the time it's full of nicotine. In Arizona, they did a research at a school where they took all their confiscated materials, and somehow they were lucky enough to have the funding to test all the nicotine products in the vape juices and found that 96 or 97% of the products did have nicotine in them. So even though the packaging didn't say this has nicotine, they did have nicotine in them. A lot of the youth too don't believe that it has nicotine in them, so they don't think they're going to get addicted to these products. So they produce large clouds of vapor, which have a subtle smell of whatever it is. So if you're smoking something fruit medley, you might smell a little fruity smell. Nothing too crazy. That's why people are able to kind of take these in school and easily vape them. However, we know it's more than just water vapor. These are some of the chemicals that have been found to be in the products. So lead, nickel, nicotine, benzene, so stuff that you probably wouldn't want to inhale. This is a whole list of other chemicals that have been found in certain products, not all in one product, but multiple different products. And the compounds in yellow are from the FDA's harmful and potentially harmful substances established list. So it just goes to show you there's a ton of chemicals in there that you do not want to be breathing to your lungs. A little bit more about what else you can find in these chemicals. So we have propylene glycol, which can also be found in antifreeze. So that's a chemical that can be found in e-cigarette juices. Acetone, which obviously can be found in nail polish remover. Ethylbenzene, which is found in paints and pesticides. Formaldehyde, which is used for embalming. Nicotine, which is found in cigarettes, one of the most harmful ones. And rubidium, which can be found in fireworks. So all the good stuff is in these products. So again, if there's anything you take from this presentation tonight, it's not just a harmless water vapor. There is chemicals in there that you do not want to be taking into your lungs. There's nicotine, there's ultrafine particles, and one way I like to say it too is it's more of an aerosol than it is a vapor. So if you did like a bathroom spray and like all the particles and chemicals that come out of that, it's very similar to that. And we'll touch a little bit about secondhand smoke and thirdhand smoke in a bit as well, because we're seeing those similar effects. There's cancer-causing chemicals, there's heavy metals, and there's also flavoring such as diacetyl, which is a chemical linked to serious lung disease called popcorn lung, which can also lead to breathing problems down the road. So why are we concerned about these products for youth? A ton of different reasons, of course. So brain impact, we know that youth brains aren't fully developed till about their mid-20s, so any kind of products that they try out, whether it be alcohol, marijuana, drugs, nicotine, is going to be very harmful to their brain and kind of affect them in the long run. Addiction, so the nicotine in these products is very high, especially in Juul, so youth are getting addicted to these products. We have nurses at the schools who are saying they have students come into their office and they're literally shaking because they can't have their vaping products or they haven't smoked something all day. So they are getting addicted, regardless if they tell you, I just tried it once and not addicted. They can get addicted to these products. Behavior risk. So they've done a couple studies and they found that people who have started using these vaping products or e-cigarettes have actually later in the future turned to smoking conventional cigarettes. So it's kind of bringing us back to our old ways. We're kind of doing a circle again. And I think eventually once we see these products fade out, we're going to have a lot of people addicted to nicotine still and still smoking tobacco products. Another youth health concern is the harm to the lungs. We talked a little bit about popcorn lung as well as the chemicals that can be found in them that you wouldn't want to ingest. And then another one we're going to show a short video in a minute is unintended injuries. So the lithium battery in these products has been known to explode. And I like to tell it because one teacher at one of the schools in Cumberland had one of these products in her backpack because she was bringing it back to the guidance office. And all of a sudden she smelled something burning and she's wondering what it was. And she's looking all around, no fire, no nothing. Fire alarm wasn't going off. And there was another teacher behind her. And she said, your backpack's smoking. So she opens it up and there's a vaping device smoking right in there. It was one of those mods, the block ones. A lot of these products are bought online from different countries, so they're not made as great as if they were made in the US. So that's kind of another reason why they're exploding. So a lot of the youth, when we go and do presentations, tell us, so what's so harmful about these products? No one's died from them. We do have one death, and it's because of a vape pen exploding in a man's face, unfortunately. This was in Florida, and he had a vape pen, and it exploded and caused some injuries to his face, unfortunately. Another news article we like to come around is teen developed wet lung due to vaping. So this was a teen from, I believe, Pittsburgh, who had just been using vaping products for 3 weeks or under and started to develop some breathing problems. Went to the doctors, told her doctor that she had been trying out the e-cigarettes and found out that she had wet lung, was put on a ventilator and had trouble breathing. She ended up having a pretty decent hospital stay as well. So yeah, there is very harmful effects from these products. So we're going to show a short video of a vape pen, I believe, exploding on a bus, just to kind of show you.
A man smoking his e-cigarette on a Fresno, California bus. Well, the driver sees it, tells him to put it out.
You can't vape on the bus, man.
You hear the bus driver warning the man. You just said you can't vape on the bus. So he complies. Moments later, though, the e-cigarette explodes. You can see the aftermath there. Our affiliate KGPE reports the victim was treated for minor burns to his hand and thigh. This on the heels, of course, of some other surveillance video we showed you a few days ago of an e-cigarette exploding at a wine store in New York because it was in the employee's pocket at the time, we're told. The man reportedly needed surgery for his injuries.
So it is kind of scary. We are seeing a lot of different unintentional injuries with this product, as well as the health issues that we're going to see arise in the near future. So long-term impacts and risks. This is one of our favorite slides because of the guinea pigs. So what we say is they're having the youth in this generation be the guinea pigs. So these are brand new products. They were developed in China in, I believe, the early 2000s and then came to the US a couple years later. And now we're starting to see these high-tech devices that youth are getting their hands on. They love the flavors. They can easily hide them at school. It's something that they can bring with them everywhere. So they're getting hooked on these products, but they haven't been around long enough that we know the exact long-term effects of them, which is unfortunate. So it's easier with tobacco products like first-generation e-cigarettes and cigarettes because we can see what's going to happen. But now with these products, we kind of have to wait it out. We do know from what happened with cigarettes and the chemicals that are found in it, what the consequences are going to be. But right now, there's still a lot of unknown about these products. So vaping and third-hand smoke, this was an article that just came out the other day that kind of just went over in a California mall how there was a vaping store there and how they were able to find the e-cigarette residue in, I believe it was the store next door. So there is some third-hand smoke that's coming out of this, and third-hand smoke is if you find the residue from the smoke on like your clothing or on the carpet or on the walls, if you ever see like the yellowing of the walls when you go into a past smoker's house. So very similar to that. So they're starting to see a lot of this with e-cigarette products as well. So they have found some evidence on third-hand smoke and vaping. So vaping media ads, youth are the target. More than 18 million, so 7 in 10 US middle and high school students were exposed to e-cigarette ads in 2014. Like to call it the flavor trap. They're getting them in by all these crazy candy flavors that they have. It's how tobacco companies are luring the kids in. So these are just some of the flavors that they have, and we have put on the side kind of referring them to the actual food product. I think one of the most eye-opening ones for me is the juice boxes. So if you think about it, how many adults in here are actually craving a juice box? That's something that most kids are gonna want, not typically adults. Stuff like vanilla wafers or Oreos, those are mostly kid products. Lollipops, they have Swedish fish flavored, they have all these crazy kinds that are targeted towards youth. So clearly there's something here saying that they are targeting the youth. There is about 7,000 to 8,000 flavors on the market right now, and that just keeps growing every day. So kids are able to get these flavors online. You can look it up online and it will show you a bunch of different stores where you can buy them and all the different flavors. It's actually pretty interesting. Here's another one. This is just very similar to the Trolley Sour Bright Crawlers with the gummy worms. And they have a flavor just like that, shockingly. So advertising e-cigarette ads reach nearly 4 in 5 US middle and high school students. More than 20 million youth saw e-cigarette ads in 2016. Whenever we go to do youth presentations, we always ask them who's heard of the Juul product, and almost every hand goes up in the room. At first they're like a little hesitant because they think they're gonna get in trouble, but we're just asking them if they've heard of it, and everyone's heard of it. They've seen it on the billboard ads, they've seen it, there's big signs out on the store, so it's everywhere, the name's there, the messaging is getting out there, unfortunately. So celebrity promotion. This is actually a video of Kylie Jenner, so one of the Kardashians, who youth really follow nowadays, and she is vaping. This was found on her Snapchat. So they're using celebrities to kind of promote their products, and celebrities are not afraid to put this stuff on their social media accounts either. These are just a couple examples of e-cigarette advertising. So the one on the left definitely really stands out to me because it has a to-do list on the top where it says study, groceries, band practice, and vape time. So most adults you know aren't studying. Most adults you know don't have band practice. Some do, which is nothing wrong with that, but you can tell it's very youth-oriented. They have the Post-it note on the laptop right there. They have the vape pen sitting there with the little sticky notes in the planner. The one on the right is glamorizing the product. So here it says smoke in style with blue electronic cigarettes. It said freedom never goes out of fashion, control when and where you want to smoke. So just another way that they're advertising and trying to make these products seem like they're really cool. It's something you want to do. So it's very similar to what we saw with the cigarette products, which kind of resulted in the big tobacco settlement. These ones are interesting, so they kind of relate it to weight loss in a way. So the first one on the left is maple pancakes, and the one is vanilla cupcake on the right. And if you see on the label, it says inhale flavor, curb cravings, lose weight. So they're trying to say by smoking these products, you can lose weight. It's gonna basically be like you're eating a whole plate of pancakes or having a whole cupcake. I'm sure the flavor is the same, but I bet it's not as satisfying as eating a plate of pancakes. So again, they're trying to appeal to people. They want people to be interested in these products. They want people to start trying them and get addicted to them. So one of the campaigns that the Maine CDC and RINC has come out with at the moment is called You Are the Target campaign, where they talk about marketing in Maine, typically with the vaping companies. But this is an ad, and these are played all over social media. Did you want to throw anything?
So the interesting thing is that tobacco companies have spent over $42 million on advertising these products in Maine alone. With the master settlement agreement that I mentioned earlier, each state kind of gets a different rate for prevention services. Maine gets, for the whole state, for tobacco prevention, about $5 million. So these tobacco companies are spending almost 9 times that just in Maine alone for advertising.
So it's definitely hard to keep up with when there's that going on. The good thing is there is examples out there of anti-vaping materials. This is from a public health department in California. They decided they were going to come up with their own vaping media campaign, anti-vaping media campaign, where they kind of call out on these vaping and tobacco companies. And you can check these out at stillblowingsmoke.org. They have all their campaigns and ads up there.
This is just another one that says there's a lot the e-cig industry isn't telling us about vaping. Wake up.
So another thing that is very interesting is they have some accessories out there that a lot of youth have been purchasing. One of them is called Vapeware. So youth can go on this website and purchase sweatshirts where it's easier to conceal vaping. You can see it has like the little part right there where you can blow smoke into and blow the vape out. They have hats, they have backpacks, they have any kind of vape gear you can imagine, and they're pretty decently priced. I think the sweatshirt was about like $30. And when you go onto the site, it's asked if you're 21 or over. Obviously, everyone's gonna hit yes. You're still allowed to purchase it, so they get around it somehow. On the right, these are jewel skins, so they're kind of covers for people's jewels. This is something that can be found on Etsy. You can find them at, I think, Walmart, we saw them. They're all over the place. Amazon, you can get them anywhere online. They have tons of different designs. So youth kind of like to personalize their vape devices. They also have one that looks like a little USB and it says 2 GB on it. So vaping in Maine schools, this is happening all over the country, but there have been a couple news articles highlighting just Maine and the issues that we're having. And this one was actually talking about Cape Elizabeth and how this kind of problem just came upon, and none of the administration was really expecting these e-cigarette products to become so popular. And it's happening in all the schools. It's not just here in Cumberland County, it's not just here in Portland, it's not just in Cape Elizabeth, it is everywhere. Schools are taking action though. They're educating their teachers, they're educating youth, they're educating parents like here, which is fantastic. So we're getting the message out there, which is super helpful. So Maine laws. So the great thing is that Tobacco 21 passed and started as of July 1st of this year. So you have to be 21 or over to buy any tobacco products, and that includes electronic nicotine devices. The age recently changed from 18 to 21 as of July 1st, 2018. In 2015, Maine passed a law prohibiting the use of e-cigarettes in the same public places where smoking products are prohibited. So parks, restaurants, any places that regular cigarettes are prohibited.
I will add too that it was an age group that was kind of grandfathered. So if someone was between 18 and 21 before this date, they're grandfathered so that they can buy these products. So businesses will actually have to check identification and make sure that they're selling.
The good news is here in Portland, they're not grandfathered because we had Tobacco 21 as of a couple years ago, so there is no grandfathering, which is fantastic. But in the rest of Maine, there is grandfathering. Just some information. We have the quit link that the Maine Tobacco Helpline, so you can go on and do online referrals if you're interested. And what it is, it's a free helpline. You talk to a tobacco prevention specialist over there. It's confidential. Kids who are 18 and under can use it. The only thing is they can't get any of the nicotine replacement products, so any of the gum, any of the patches, they typically will provide them to people for free if they go through and do this Maine Tobacco Helpline. But if they are youth, 18 and under, they can still call the Maine Tobacco Helpline and still get the counseling, but they cannot get the nicotine replacement products.
All right, so now I will be talking about marijuana. Just a brief overview, marijuana, what is it? I think most of us know. How it can be used differently, the legality in Maine, concerns surrounding vaping. Plot twist, marijuana can be vaped as well. Health concerns, specific Maine data, and then some resources on how to talk to your teams. I know that these are not easy topics to broach, and it can be difficult to kind of just dive into, are you doing drugs? Yes or no? So marijuana comes from a plant, the cannabis indica or sativa. Typically, it is the most commonly used illicit drug in the United States. So across the board, it is federally illegal. That's why I say illicit. It contains the main component, like in tobacco products, the main component is nicotine. This main component is THC in marijuana. It also contains roughly more than 500 different chemicals as well. And it can be smoked, it can be mixed in food, it can be vaped as well. Marijuana today, also referred to as pot, weed, ganja, Mary Jane, etc. There's so many different slang terms out there, and I think there's newer ones every day, similar to the vaping terms. Marijuana today is more concerning because it contains higher levels of THC. Not only that, but people are always developing new ways to extract higher levels of THC in the products. Because it is a plant, most people think that, it can't be that harmful. There's a growing perception among youth especially that there's a low perception of harm. Because it is a plant also, it can contain harmful pesticides. And it is legal in some states for medical use, it's legal in some states for recreational use. In Maine, it is legal for both. And then how it looks, it's either leaves, stems, or seeds. It can be greenish, brownish, or grayish in color. So the flowers, the stems, and the leaves, they can be smoked or inhaled in cigarette form, known as joints. They can be used in water pipes, such as bongs or hookahs, pipes, which are also referred to as bowls, blunts, which are similar to joints, but they use the cigar wrapping. And then they can also be consumed in food or beverages, and they're known as edibles in that form. So some other common forms, this is called hash or hashish. So like I mentioned earlier, people all over the country try to kind of make their products stronger by extracting and concentrating them so they have higher content of THC, so that mind-altering chemical that's really responsible for the high feeling people get when they smoke marijuana. Hash is the resin separated from the flowers in the cannabis plant. It's usually this golden brown looking thing, and it's kind of like a solid, it almost looks like wet sand to me. And it can be used by smoking, eating, or vaporizing. This is another form that is becoming more and more popular. So the cannabis oil, it is really concentrated, so it can contain upwards of about 75% THC. It can be smoked when it's vaporized. It's referred to as dabbing. And one dab is the equivalent of about 5 joints, so it's very, very strong. Oh, and I should mention, the way it's extracted is there's butane gas that's forced through kind of these long glass cylindrical tubes. So it's a very flammable fire risk. So every now and then we see in the news like, oh, someone's apartment building burned down, and people investigate and they see that they had all these tubs of butane for extracting the butane oil or cannabis oil from the marijuana plant. Another way that it can be consumed is via edibles. So in Colorado, where they were one of the first to legalize recreational use of marijuana, serving size is typically gauged to be 10 milligrams of THC. The issue is that not all of their products are single serving. So if someone were to purchase a brownie, you really have to pay attention and look at the packaging because it could have up to 10 servings. Something to be mindful of, because I don't know that I've ever sat down and had just one bite of a brownie, personally. And that is what people would have to do to get that one serving. It also takes longer to feel the effects of edibles. So that's something that's concerning with youth because, you know, if someone consumes one brownie, 10 minutes later they don't feel anything, they say, well, this didn't work for me, let me have another one. Well, then they could have some negative consequences as a result. Although no one has overdosed and died directly as a result, people have experienced marijuana overdoses where they go into kind of have a rapid heartbeat and feel very unstable mentally, psychologically start seeing things, and it's just not a very pleasant feeling. So it's something that when we go present to youth, we like to stress that, you know, just know that it takes longer for this to kick in, so people should be very cautious. This is a pretty cool map. This actually shows where the states are that have legalized marijuana for medical purposes and where the ones are that have legalized for recreational. The ones in blue are medical, so it's about 29 states currently. That might change with the current election coming up. And then the green ones are about 9 states and DC that have legalized marijuana for recreational use. I mentioned marijuana vaping earlier, so there are some devices out there that can be used to vape marijuana. These are, one of the most popular ones is the one on the right. It's called the PAX. So you can actually use the dry marijuana and you put it into the device. You can set the voltage setting and vape marijuana. There are also different products. So the one on the PAX is about $200. The one on the left is a little bit cheaper. It's about $70. It works similarly. And it either takes the dried form or it can take an oil form. There are also other vape devices, so similar to the ones that Krista talked about, where you have the liquid, the e-juice that you put into a chamber. This has a chamber where you can put extracted cannabis oil into it, and it works the same way. It heats it into a vapor. So some common effects people might experience short-term from the use of marijuana are increased laughter, increased appetite, short-term memory loss, dryness of mouth, reddened eyes, maybe an altered perception of time. And then I mentioned earlier that because they're a plant, they often have pesticides in them. So that's something to keep in mind, that there are toxins that are present within marijuana as well as conventional tobacco products. So why is this concerning to youth using? It can really impair the brain. So as we talked about earlier, youth brain is developing until about age 25, we think. So starting to use marijuana at an earlier age can be linked to a decreased ability to learn new skills. So you're doing a lot of learning when you're in school, in high school, and this could really affect the brain, its ability to make decisions, how alert and attentive someone is, which is indirectly linked to an increased risk of vehicular accidents. So if someone who has been smoking gets behind the wheel, they might not have that quick reflex or reaction time that you want to have, might not be able to concentrate on multiple things at once. And then long-term on the body, lung damage is a particular concern. So people who smoke marijuana usually inhale deeper and they hold the smoke in their lungs for longer periods of time than they do with cigarettes. Impaired immune system is also of concern. Lower IQ, dependence and addiction, as well as some increased risk for depression and anxiety that is more common with people who start using when they're at a younger age. So when you're a teenager, that puts you kind of at a risk for having some of those mental issues later. Marijuana can be addictive. So marijuana use disorder is a diagnosable condition. People who smoke, about 9 to 30% who smoke marijuana may develop a marijuana use disorder, and this is increased in those who start at younger ages. So people who begin using before age 18 are 4 to 7 times more likely than adults to develop a marijuana use disorder. And this comes from the National Institute on Drug Abuse. So then some relevant Maine data. Maine parents were polled in 2017 by Pan Atlantic, and the studies found that more than 9 out of 10 Maine parents believe that their child has not used marijuana in the past 30 days. So more than 90% said, no, this is not happening, this is not something I need to worry about, my child is not using marijuana, I would know about it. Then we found out what the youth had to say. 33% of Maine students have used marijuana at least once in their life. When asked specifically about the past 30-day usage, we found that it was about 19% of Maine high schoolers that said that yes, they had used it recently. And then out of those that did use, 19%, or about 1 in 5 students in high school said that when they started using marijuana, it was before the age 13. So things to keep in mind as we are kind of in this transitional period in Maine. So we passed the law that made marijuana recreationally legal. We have yet to establish any sort of retail establishments, but that is something that, city and state governments are kind of talking about on a daily basis almost. So specific Maine marijuana laws are that it is legal currently for medical and recreational use in adults who are 21 aged and older. Retail stores will be opening in the future, and as of right now, adults who are 21 or older can have about 2.5 ounces of marijuana on their person. Having more than that is subject to jail time. And I don't know if anyone knows, but 2.5 ounces is the most that any state has ever said is legal to have on you. Even Colorado has lower limits than this. It's an extremely high amount. So then just some good tips on how to talk to your teen. These can be for any sort of topic, not just marijuana or vaping. Knowing the facts, so getting the credible information that we talked about. We use all of our resources or generally come from like the CDC, NIDA, the Maine Integrated Youth Health Survey, other relevant data sources. We can provide you with resources if you need them, and there's also some available on the parent university's website. Being open and ready to listen, so being able to kind of broach that conversation without having your mind made up or ready to respond. I think sometimes we start having conversations and we're just listening so we can have a response, but we're not really listening. Along the same line, being patient and kind of trying to keep your conversation positive, so not criticizing if your child admits that they have tried something once or twice or things like that. And then finding the right moment, so looking for those natural times to have the conversation. Maybe you're watching TV, maybe you see an ad about smoking, maybe you see a prevention ad, maybe something comes up on your Instagram or their Instagram and you happen to notice it. So just naturally flowing into that conversation. And also empowering your teen to make good choices. Primary prevention is about having the foundation to make those choices. And really giving people the power to know how to choose what's correct for them. A good prevention tip for parents. So, like we said, marijuana is perfectly legal to use if you're an adult over 21 years of age in the state of Maine. It is not something that it is up to you to make that decision. But in doing so, if you do use, it's a good idea to make sure that these substances are put far away from your kids. Be aware of the example you're setting, maybe not using them in front of your children. Safety at home, so safe storage up and away. We have this great little lockbox that we bring around when we talk about prescription medication storage. So you can set a code on it. It's not indestructible, but it will probably prevent a teen from tampering with too much. And you can just put it out of plain sight, you know. So making sure that these products are put away, you might have to adjust where you're putting them away, you know, as your child gets older. So making sure a toddler doesn't have access to a pan of brownies that may be edibles. It would be different tactics than if they were older. And then just having that conversation, making sure that your child knows that you have clear rules and expectations in your household. Like I mentioned earlier, we do have some additional resources. These are small, so you don't have to worry about reading them right now, but we'll, I think we'll have access to our PowerPoint, and these are mostly going to be up on Parent University. So Maine launched a Good to Know campaign recently, and it's all about marijuana, youth prevention, what the laws are. It seems like they're changing almost daily. Maine Prevention Service partners, so you can find someone who's in your region. You're all from Portland, so that would be us. Drug-Free Partnership, they have a lot of great tips on, again, how to talk to your kids. And just the things you need to know, great resources, how to talk to your kids about drugs if you did drugs, which is something that I've heard from adults that they have struggled to do in the past.